to welcome everybody to this fourth session of our Pathways TES Affinity group. You guys will recall this is the fourth of 4 sessions, and today we will be continuing with the Pathways TES, which is a structured approach to data sharing. And we'll be on session 4, and we'll be talking about data sharing agreements and Sonoma County's yes, which will make more sense to you guys as we go on. But next slide, please, Travis. So just to introduce our facilitators, again today we have Chris Alibrandi O'Connor, who is a Deputy Director with the Mid-States region of the Network for Public Health Law. And I am Stephen Murphy. I am also with the Network for Public Health Law. I am a senior attorney also in the Mid-States region. And then we are also joined by Travis Parker Lee, who is a senior specialist at the Public Health National Center for Innovations at PHAB. Next slide, please, Travis. So this is really just a place marker. I will have some announcements about some very exciting happenings at the end of the presentation today, including around the evaluation for all of the sessions in our 4-part series. And then also some updates on the All-In National Meeting and also the Network for Public Health Law's Fall Summit on Health Equity and Cannabis Law. And then I also just have a quick couple of reminders around resources that are still available to you, even though our sessions will end today. And with that, I'm going to ask Travis to forward it to the next slide, and I'm going to pass the baton to my colleague, Chris.
Okay, thanks a lot. Travis or Stephen, let me know if there's any issues with the audio, because my computer is definitely wonky right now. Okay, so one thing we're very excited to be able to share with folks today is that, as we put out in the news ahead of time, is we've got a guest speaker. Barbie Robinson is the Executive Director of Harris County Public Health, which is in Texas. It's the 3rd largest county in the country. And she's also the former director of Sonoma County's Health Services in California. She is going to be speaking specifically about the Sonoma County's data sharing effort, where there's data being shared across multiple government agencies, all the so-called safety net agencies, and systems in order to improve, create a better care coordination system for the county's most vulnerable residents, as well as the whole myriad of other experiences that she brings that I'll talk about a little bit more when we formally introduce her. Okay, so you've seen this slide 4 times now. Today, we already talked about the Pathways TES framework. We talked about, reviewing your relationships with your stakeholders and such, developing the use case for why you're sharing the data, how it would be shared, creating the data use map to really track out how is the data flowing for security purposes, for legal analysis purposes, and then conducting the legal analysis. And then today, the punchline is basically about establishing and documenting the terms of the sharing to round out, getting to yes. Could you go ahead and advance, please? Okay, so one more, please. Thanks, Travis. So the learning goals today are understanding what we hope you come out of this today with is understanding the functions of a data sharing agreement, recognizing the different uses for a data sharing agreement versus a memorandum of understanding. And we'll talk a little bit about business associate agreements, which comes up in the context of HIPAA. We hope you can identify common terms that are used in DSAs or MOUs. And hopefully after we hear from our guest speaker, you may be able to apply lessons learned from Sonoma County's data sharing project to your own projects that may look, like the effort that you're going to hear about. The usual legal disclaimer: we're not your lawyers. We love you, but we're not your lawyers. So don't rely on anything we say as legal advice today. But there we go. Next slide, please. Okay, so let's talk about the functions of an agreement to share data. You can go ahead and click the next one. It's really like it's like contracts 101, right? It captures the understanding of whatever it is that the two people or the two parties are agreeing to do, or in some cases not do. Like, it's like making hula hoops. So like how many, it captures how many hula hoops you're going to be making, what colors are they, by when, like what happens if the hula hoops can't be made for some reason, or what if they end up square instead of round, right? So it's the process of drafting the agreement, or in the process of drafting the agreement is how you get to consensus on what, how you're going to establish and document the terms, right, of the data sharing. So it's the nitty gritty that you really hammer out in the process of creating the data sharing agreement. You may have thought you figured it all out and talked about it before you put it to paper, but it's when you put it to paper in the data sharing agreement where all the other nitty gritty details that you thought you were all on the same page about, you weren't actually, and that's a good process. They're getting them captured. So the functions of the agreement to share data. You can hit all of these, Travis. It ends, there's like 5 or 6 of them, bring them all up. So it describes the relationships between the parties, right? It describes the project's purpose or the goals of it and how the data sharing supports that, goal or that purpose. The data sharing agreement will clearly state the legal authority, because if you think about it, especially for those of you who might be sharing protected health information where HIPAA comes in, or maybe you've got state laws that deal with mental health records or substance use records. Oftentimes you need to state the legal authority in there so everybody knows and is on the same page that yes, there is legal authority for sharing this data and how we're doing it. It outlines the terms agreed upon by the parties. Another function of the agreement is to identify the specific data elements that are going to be shared. Again, the nitty gritty, you think you agreed to share this, but it's not until you get to this point of the discussing what's going to be shared and putting it in the agreement that you realize, oh, we weren't of like mind necessarily. It clarifies that. And then it also, provides monitoring and accountability methods for compliance, because both parties, or maybe just one party, may have obligations to protect the data that they're sharing, and for their own legal protection, I guess you want to say, they may want to make sure that there's language in the agreement for, okay, who's actually responsible and accountable for the compliance of making sure we all stick within the, stay within the lines we got to stay within. So one other thing is also, the function of the agreement may also be, where you can agree on minimum standards for security to make sure, sorry, somebody out in the hallway, sorry, minimum security requirements for all the participants that are, in the game. It's also a place where you might want to, it's also, the process is where if there are other related agreements that may be kind of floating around in the periphery, either they already exist or they're going to be somehow related, for example, a business associate agreement, or maybe the parties have some kind of agreement in play, or where they want the agreement they want to set up is kind of piggybacking off of some other agreement that already exists, but you have to make sure that the agreements are in sync with each other, that they're not, going to be in conflict, right? Or it's splitting the responsibility between two parties in one agreement, but only one party is, responsible in the other agreement. You have to make sure that that's all synced up. Okay, Travis, go ahead to the next slide, please. Okay, so there are, in the context of data sharing, there are a couple different types, main types. There's data sharing agreements themselves. So DSAs, hence the name, right? There's also another animal called a memorandum of understanding, which is more often found in the government, like between governmental agencies. I'm going to talk about that in a minute. But wanted to make sure that we kind of also mention the fact that well, let me say this about memorandum of understanding. The key difference between the two, a data sharing agreement and an MOU, is that an MOU is not legally enforceable. Okay, so it outlines a mutual understanding. And again, we'll talk about the details in a minute, but that's really the key distinction that I always point out between the two. A data sharing agreement is a legally enforceable document, and the memorandum of understanding is not. It's generally a tool that's used by the government agencies when the parties are not looking for a legal commitment, but they want to create an agreement in principle. And it's a lot easier getting a memorandum of understanding as opposed to negotiating all the way out all the details to a data sharing agreement. The thing I was going to mention here, the business associate agreement it is a type of agreement. I wouldn't necessarily put it in the same class as the data sharing or the memorandum of understanding, but so many of you are involved in data sharing for data that comes up under HIPAA, or it's covered by HIPAA, and a business associate agreement may be a tangential, if I'm pronouncing it right, agreement to whatever agreement you're creating for the data sharing, because inherently it has to be a part of it, because the parties that are sharing data, one of them may be a HIPAA covered entity. And if a HIPAA covered entity is going to be sharing protected health information with somebody that's not a HIPAA covered entity, they generally will have to put in place the business associate agreement. Not in the context of public health, which Stephen is really good at always pointing out, because he's got more public health experience than I do, but that's just kind of a heads up there. Okay, let's go to the next one, please.
Chris, just one other point on the memoranda of understanding. You know, I think particularly in the government context, government agencies may not always be able to contract with each other. If you think about the local government context, government departments like local health departments may not be their own separate legal entity, and so may not be able to legally contract with another department within their same government, or another department, maybe another health department within another local government. And so sometimes the memorandum of understanding can be just a way of putting it on paper when you lack that legal capacity to contract.
Yeah, good point. Okay, next one. Okay, so if you're my age, or maybe a little older, you recognize this game. All right, so a DSA, a data sharing agreement versus an MOU. I mean, Stephen just made a good point. As I said before, MOUs are most often, in my experience at least, agreements that are entered into between governmental agencies. For one reason, the one that Stephen just made, they may not be, able to do a DSA because they're not separate legal entities, or there may be, some construct that prevents that. But my starting point always is that a DSA will be needed. But if you do not, if you cannot do a data sharing agreement, an MOU may certainly suit your purposes. Okay, all right. In the interest of time, why don't we go ahead to the next slide, I think. Oh, well, yeah, that's okay. I was going to say one experience that I had in New Hampshire, actually with the county, was there was a lot of trust between the parties. It wasn't all governmental agencies, but they agreed to do memorandum of understanding because there was enough trust between the groups, and they didn't want to have to go through the whole process of negotiating a contract or an agreement, because they were kind of afraid of who might come out of the woodwork and oppose it. So that's why the MOU actually ended up being a better strategic move for them. Okay, so this slide here is talking about what are some common terms that are used in DSAs or MOUs. And if there's any bird watchers out there, you may recognize that bird is a common tern. Too funny. Okay, so here are some of the common terms that you should find in an agreement, right? Obviously, the parties to the agreement, who's coming to the party, what's the purpose, any definitions that you want to have. Again, this is like Contracts 101, but if you didn't take or pass Contracts 101, then these are things that you just may want to know about. There needs to be, definitions of key terms. What are the dates, the key dates about when the data is going to be provided, if, that kind of thing. Again, if you're sharing data, privacy and security requirements are terms that you're going to want to include in your DSA. A period of agreement, is this going to go on ad infinitum, or is this we're going to do it for 5 years and then we can reevaluate? Communications also too. So why don't we go to the next slide, please? And so there are other factors certainly that may dictate what those terms are. And some of it is, I would say, Stephen, I want Stephen to speak, to the risk part of it. But one thing I'll just throw out there is that obviously, that when you're engaging in a data sharing agreement, your culture may not necessarily have, your organization's culture for, sharing data may not exactly be the same as who else you're sharing data with. So those issues you want to talk to specifically around risk. And Stephen, go ahead.
No, I agree with what you just said. I think the culture of the organization is very important. And in terms of determining the risk, I mean, you may look at the types of data that's involved and how sensitive that data is. That's also going to dictate kind of the level of risk that's involved. I think, Chris, you also just hit on kind of like, the appetite for risk. How risk averse is your organization? That may dictate the types of terms that end up in your data use agreement. And I'm thinking of things like liability provisions or indemnification provisions. And I guess I would caution folks as they put together data sharing agreements to think about the types of agreements that are going to be acceptable to all parties. And I've seen that happening where one organization wants to put the kitchen sink into the data sharing agreement, and that can be a roadblock for some of the other parties. And so I think those are important considerations in terms of the level of risk and the types of provisions that might go into the agreement.
And then another one is, sometimes an organization's policies may require other terms. And the example that I actually thought about, ironically, is from Texas, is that Stephen and I were involved in helping, supporting a negotiation of a contract. And this Texas governmental agency said that they could not enter into a contract that didn't have a finite term to it. They had to make sure that the agreement had a 5-year end date, and then they'd have to renegotiate or something after that, we thought. So and it was a bummer, but that was required, they said, by state law. So it had to go in as a term of the agreement. Okay, let's go, in the interest of time, let's go to the next one, please. Okay, so here's the point I want to make before you click again, Travis. If you've seen one data sharing agreement, go ahead, Travis. You've seen one data sharing agreement. Okay, you can pull up the rest of them now, Travis. That's what makes it hard for us. People often ask us, can you give us a template of a data sharing agreement? But it's just like with relationships between 2 or 3 people. There are no 2 relationships that are exactly alike. And that's why, maybe within an area, sometimes you can come up with a template if there's a lot of similarities between it. But if we were to try and create a template for a data sharing agreement, for example, to meet the needs of this very diverse group, it would look like a Mad Libs. You know what I mean? There'd be so many blank spaces in there, and it wouldn't be particularly helpful necessarily. Some of why data sharing agreements are so different is, some of this goes a little bit to the risk, the culture of risk or the comfort level with risk that Stephen was talking about. Is there are different environments, within a government. The work that we do with different states, we've seen how different states have very different cultures around their comfort with sharing data. And they may have state statutes that, really guide their hand on that. Nonprofit organizations may have funding source restrictions there, but on the other hand, for-profit entities may not have those kind of restrictions, and they may be more of like an entrepreneurial spirit of, yeah, let's do it, let's make it happen, we're okay with the risk of it, right? DSAs will vary by the types of data and what laws apply. Big thing lies, the level of privacy and security. And then at this point, I wanted to open it up to Travis, because Travis had a really helpful point there also, that last bullet.
Yeah, so especially when local health departments and state health departments are working with communities, they do want to make sure that the data that represents them is actually represented in the development and collection process. I think as part of All In, it is all about data sharing and it's all about communities. So just want to make sure that community voice is present throughout the entire process.
Yeah, and as we are finding, I think we're kind of at a stage of that movement you know, of including community voice, where sometimes you have to codify it, you have to capture it in writing, because people's hearts may be in the right place, but their follow through isn't necessarily there, because it's work, you know, it's work making sure you've got community voice, because it's not how it's generally been done. So codifying it, capturing it in agreement is one way to kind of keep us moving towards that ultimate goal of it being a given.
Chris, if I could just add, you know, I think in our audience today and in the other sessions, we have attorneys and we have non-attorneys. And I just want to point out for those folks that might be sitting there thinking, well, I'm not going to write the data use agreement, so, you know, why is this relevant to me? I do want to encourage you guys to work closely with your attorneys when you're developing a data sharing agreement, because you will know the business, you will know your program, and you can provide valuable insight to your attorney on what will work and what will not. You know, I think we've talked about the inclination of attorneys, kind of that knee-jerk reaction to always say no. And I think similarly, when it comes to data, when it comes to data, there's a knee-jerk reaction to throw the kitchen sink into the data use agreement. And I think it's important for you to bring that voice also from the program to spell out, you know, what things will work and what won't. Like, you, for example, you may have an attorney that will just decide that, like, oh, well, we'll just do this agreement and everything has to be de-identified. And you may be the one to bring to the conversation that, like, that's a non-starter, like that's not going to work. And if that's where we're starting from, then we might as well not be here, or we, you know, whatever your position is. So I guess just keep that in mind, that the attorneys just, they, you know, they know the legal stuff, but they do not know your program as well as you do. And you may have to push back on some things.
Yeah, great point. Absolutely. We should not pretend, we the lawyers should not pretend to know the details of this stuff as well. And you should not be intimidated by a lawyer who acts like they do. Okay, so let's go to next slide. I'm really, really so happy to be able to, and Travis, this is your chance to, I have a couple more slides and then you can tee up Director Robinson slides. Next slide, please. So I'm so excited that we have this guest speaker today. Barbie Robinson is there. If you click on at the very bottom of the slide, you can see that there's a link. So actually, when you look at the slides later, I really encourage you to click on where it says biography here and get many more details about Barbie's experience, because, you know, there's only so much time in this presentation, but you know, she's got 27 years of experience in healthcare administration. She's currently the executive director of Harris County in Texas Public Health Department. Before that, you know, during the COVID years, she was a director of Sonoma County. I guess maybe you traveled in the middle of COVID, you went from one to the other, but started in Sonoma County Department of Health Services for 5 years as the director there. And while the focus of what she's going to be talking about today is Sonoma County's Access Initiative, which was, it's received awards for its efforts. As I said before, it's a care coordination model that has much deeper data sharing across governmental agencies to really create more of an effective system, but she'll go into the details of all of that for you. I really encourage you to read her biography because it goes into more detail about other work that was happening in Sonoma County. Ms. Robinson is, besides being a lawyer, also has a master's in public policy, health and social policy, and just has a real, just broad experience that she brings to this. So I think that's all I'm going to say by way of background, because the biography is there, and I always like to hold up people who have done amazing things, and that's, in the interest of time, I really want you to read the biography bit, because that's where you'll read all these amazing things. So with that, why don't we go ahead and switch over to your slides, and thank you again very much, Barbie, for being here with us today. We really appreciate you taking the time.
Thank you for the invite, Chris, and good morning, good afternoon, depending on where you are. I'm on the East Coast today, so it's afternoon for me already. I really appreciate the opportunity to speak with you guys about the work that was done in Sonoma County that is now being done in Harris County, Texas, that is actually being replicated across the country and other jurisdictions, this model of care for vulnerable populations that are shared across multiple systems. So I wanted today to provide some context for our work because that will give you some insight in terms of the responses that I will share to your questions later on if you have them. Can you go to the next slide, please? So I want to start by just providing some insight in terms of my vision around the work that we do to help support. I've been in government for majority of my career. I see public health as the health strategist, and what that means is bringing together all of those different partners that impact the social determinants of health, coming together to coordinate care for populations to improve outcomes. And so ACCESS stands for Accessing Coordinated Care and Empowering Self-Sufficiency. I created this model in Sonoma County. And as I said, it's being replicated. It's being replicated here in Harris County, the third largest county in the country. And this model's ultimate goal is to provide intensive wraparound individualized services for shared populations. And what I mean by shared populations, it's individuals who have a multitude of needs across government and community-based organizations, systems and programs. And so it is quite a disservice. A lot of government focuses on getting people into the safety net. And yes, they want them out of it, but we do a lot of work around getting them in. And quite frankly, our singular agency focus is a detractor from actually getting people out to greater self-sufficiency and well-being. And so a hallmark and critical piece of this work is enabling technology and data. And so I'll dive into some of that. And it involves the safety net departments, and I'll speak a little bit about who they are in both Sonoma and in Harris County. Next slide. So here's the challenge. I know that there are questions around how did you get to a state of being able to get stakeholders to the table to want to share data. Well, we know, right, there's the value proposition for safety net agencies is a recognition that there's a cohort of folks that touch multiple systems that quite frankly, we've been ineffective in serving because we don't collaborate and coordinate the service delivery model for that population. And so what we have, right, from a singular agency model is services and programs that are not integrated. Staff across programs do not systematically collaborate. So I may know Chris, right? And I work in housing, and I know Chris over in human services just because, we've met, or she left my agency and went to another, and I may be on an ad hoc basis able to pass someone off to Chris, right? That's in need of her services, but that's not systematic or systemic to how we do services. And what we have is inefficient service delivery. In terms of folks trying to navigate our systems. You couple that with the siloed system. So we're unable to share key information across programs and agencies to more effectively deliver services. If I am a homeless coordinator and there's an individual that's open to behavioral health system, right, in the mental health program, not knowing that and not having insight may impact and limit the resources or services and programs that I offer or try to create and provide to someone who also has a mental health challenge. And then of course we get into siloed categorical funding where the inability and limitations around pooling our dollars. And what government sees is suboptimal outcomes. The lack of integration is a barrier to services. We see poor outcomes. We see individuals, for example, with mental health challenges blowing out of housing placements due to their mental health illnesses because they're not coordinated. We see individuals with, co-occurring medical conditions that are impacted without having access to quality, they're experiencing food insecurity or economic insecurity, and we're not tying all those things together. And what we see is, administrative inefficiencies where, an individual is running around town to all of these different systems, answering the same questions, providing the same information over and over again. And quite frankly, being in government, we don't make it easy for folks, right? We've designed the systems for our ease of implementation versus the ease of access, enrollment, and ultimate, service delivery. Next slide. And so what the solution is an integrated safety net where the frontline staff across safety net departments, across health services, human services, behavioral health services, economic assistance, some of our criminal justice partners, depending on the populations we're talking about, probation, our public defender, those frontline staff come together and they talk about what the needs are of individuals that are shared across these multiple systems and do coordinated problem solving and goal setting. Now, in order for them to be effective, they're using data. They're sharing data across these different silos in an integrated data hub that provides a 360 view of who these individuals are. And they're able to create an integrated care plan to help assist those individuals. What is necessary and important is, of course, the portfolio of services and interventions that are available that are happening in silos right now, the medical services, mental health, housing, et cetera. And then, of course, braiding and blending our resources, whether that's through staffing or literally braiding our dollars together, as we did in Sonoma to create the technology, blending, hiring different staff to support the initiative for the different cohorts. And what Sonoma has experienced is some incredible outcomes. They focused a lot on homeless individuals, for example, moving folks from shelter to housing. Is typically an 8%, nationally 8% success placement rate. Sonoma County was 4 times that rate within a very short period of time. Most individuals getting enrolled into Medi-Cal or other economic assistance, food assistance programs, SNAP, et cetera. So it has been phenomenal work that has occurred in Sonoma and that is happening in Harris County as well. Next slide. So a little bit about the enabling technology. So what's enabling these teams to be effective is the creation of an integrated data hub that masters clients across the systems and creates a mastered index of these individuals that provides a 360 view of these individuals using key information that the teams actually determined was necessary to help support and enable them to do care coordination. And then there's a community health provider portal where referrals to the program or referrals out to services in the communities can happen to help support individuals. And then, of course, the care coordination module, which is the case management tool, which is IBM Watson Care Manager. And then the community health portal, which allows those clients that are participating to interface with their care coordination team, members of that team. Next slide. Before diving into data sharing technical challenges, I want to talk a little bit about the governance structure. So in Sonoma County and in Harris County, the executive leaders of health, housing, the sheriff, the district attorney, the public defender, the probation chief, the human services side, right, where that's resources for children, individuals that are in the foster care system, parole within the state of Texas. We make up what's called the Safety Net Collaborative. It's the same model in Sonoma where the executive leadership is the governing body over the initiative. And so they are setting the policy direction, identifying the cohorts of individuals that'll participate. And so I realized I left that slide out in the interest of time, but wanted to provide that context that they're at the highest level of leadership within the county. There is represented on this governance body. And so in terms of data sharing, right, we all know that there are a number of challenges, and I've bucketed them around policy and compliance, technical, and then operational. So of course, from the policy and compliance perspective, there are a number of regulatory requirements that exist for sharing PHI, PII, sharing criminal justice data. Before embarking on this model, I did not realize that there were such stringent requirements around sharing criminal justice data and the concerns and some of the challenges we had with respect to wanting to include that data in our integrated data hub. And then in terms of just the restrictions that are placed on who can see that information, right? You talk about 42 CFR and who can see substance use data. That is highly restrictive in terms of complying with federal and state regulatory requirements. And then you look on the technical side, right? Even, wanting to share data, systems aren't constructed in such a way to share data, right? Case management systems aren't, just in the last, my years at CMS, right? The conversations around interoperability on health data, but there's not a lot of work that has been done around interoperability across safety net systems. And this model, the reason it's being replicated is because it has created the local government blueprint and model for how to share data and how to do care coordination in a government setting. And then, the semantics around the data, something as basic as how the data is captured in each safety net agency and what's required from a state or a federal agency overseeing that work, is one of the other challenges. And then, of course, when you think from an operational standpoint, caseworkers, they're used to handling data from a sort of flat, singular perspective as it relates to their individual silo, and not so much around, looking at data. Even when they do use data, it's more transactional. And this is a complete culture shift in terms of using data to better understand folks and think about them in a holistic way in order to design interventions or provide services more effectively. Next slide. And so, of course, what are the policy and compliance solutions and approaches? So the hallmark to access Harris County and access Sonoma County is consent. So the integrated data hub, we received, a legal opinion. San Diego has done great work around an integrated data hub system. They are, now working to build the model that was created in Sonoma and now being created in Harris County in terms of a holistic care coordination across multiple systems. However, the hallmark of this model of care is consent. You don't consent, right? We got a legal opinion. You don't consent whether your data's in the hub, right? In the integrated data hub, you're consenting whether this team has a right to access it. And it's an all or nothing consent. It is either you consent to the entire team having access to it, or you're agreeing to just continue to run around town trying to navigate the different safety net departments and sharing the same information over and over again. And so authorization and consent are the hallmark foundation for this kind of model. And what is really important is that stakeholder executive leadership buy-in. Two things that I strategically did in both Sonoma and Harris County was to get the buy-in of elected leadership, for them to pass a resolution saying, thou shalt create this care coordination model with an integrated data hub where you're sharing data and sharing information. And that elevated, the level of responsibility, whether it was from our, the county attorney's office in terms of how do we get to yes, right? It's an expectation that we're going to get to a yes. And how do we get to that? And so that was really foundational and set the guardrails for the expectation around collaboration. And then, taking into consideration, the organizational structure that of where the data lives and the systems that are utilized is really a key and important part of it. And then memorializing, as I heard Chris speak in her presentation, memorializing the agreements around the types of data, the purpose of accessing the data, and how the data is protected is critical at all levels, whether that's at the executive sponsorship level, the IT staff that are working on the data integration to frontline managers and frontline staff. Next slide. And then in terms of the technical solution, I hit on this already, but the mastering of a client index. It's basically taking that key information across multiple systems. IBM has done this work. They are the contractor that we worked with on both Harris and Sonoma County. And, they've done this for Department of Homeland Security and Department of Justice. So I'm pretty confident that if they say I'm Barbie Robinson across these multiple systems, that I am in fact Barbie Robinson. And then, of course, the semantic interoperability standards that we see in healthcare, applying them across in an effective way across the different safety net data systems. And so in making sure that we're all talking the same language about data and understanding how it's configured across different systems was crucial. to creating this model. Next slide. So that, I believe, concludes my slides. Because I wanted to dive into the very specific questions that you all may have about the work in Sonoma County in terms of how we got to yes, and the key pieces of data integration and potential barriers.
Thank you. That was great. I mean, it just hit the spot perfectly with the overview, like setting, so people can figure out how, closely related to their data sharing it is. So thank you. That was really a great overview. So we want to go ahead and open it up. I think this group is small enough that if you all want to come off mic, why don't we say that? Come off mute if you want to go ahead and ask a question. And if it starts to feel like we need a traffic cop, I'll jump in. So I think I saw somebody asked a question.
Yeah, it looks like Maggie has a question. She asked, have you had community and folks with lived experiences input in co-developing the platform and data standards, etc.?
Yeah, so I wouldn't say necessarily the input on data standards, but lived experience individuals are employed, right? Whether they are helping with our housing outreach or on our substance use outreach counselors, et cetera. So those individuals are actually the frontline staff that help design the system, right? From the care coordination model. They said, hey, here are the key pieces of information we believe you should know, whether you're talking about a homeless cohort. In Harris County, there are 4 cohorts that have been prioritized, a violence prevention cohort, reentry population, transitional age youth that are aging out of foster care system, and Black maternal health cohort. In Sonoma County, a homeless cohort, mental health diversion cohort, a COVID cohort, different populations, whole person care in California, as a subset of a homeless cohort, but multiple different types of cohorts around homeless folks, an overutilization group for hospital services or ED services cohort. So individuals, depending on the staffing configuration for those care coordination team, there are a lot of lived experience individuals that are involved in identifying the pieces of data that are necessary, but not necessarily the data standards.
So let me ask a question. Let me ask a question about, and this is kind of like getting into the nitty gritty part of it, right? By way of background, I'll say, so I was a foster parent for a while, and one of my kids had multiple engagement with lots of different services. So I was living and breathing the need to interrelate that data much better. So I didn't have to carry the information around everywhere with me and report all the updates with everybody. But one of the challenges of there being such shared data is that it can have detrimental effects potentially on someone. If you think about somebody, so this is my question for you is how did you navigate this, or how did you approach these situations where, as you mentioned, criminal justice, like what if someone within the system has access to, if the criminal justice department has access to information about other parts of someone's life that could lead to issues with a probation officer, or a more potentially benign example is if somebody's living in public housing and, and you're supposed to have, 2 kids living on the lease with them, and yet it comes out through the system that they've got other folks living in the lease with them, maybe because those other people are accessing services, that potentially could be seen as a lease violation, and that potentially can have ramifications negatively, negative ramifications with a family. So how did you negotiate and how did you navigate those kind of issues of figuring out what the right level of protection was for the greater good of needing to share it?
So as I said, the hallmark of this system is consent. And this is about care, right? Which I think is the paradigm shift that we worked with our what we call internal services departments, whether that was our county attorney, our IT folks, that the driver of this is how do we get to the best outcomes we want to see for the individuals that we're serving. So I want to be clear, the district attorney staff does not sit on a care coordination team. They sit on a governance body because they're impacted by whether or not these systems work effectively, right? The goal is to go, it's not upstream, right? But it's to have effective programming so that we don't see the kinds of impacts on the criminal justice system, for example, when we're talking about homeless populations or reentry or violence prevention, recidivism, and things of that nature. So I want to be clear that the hallmark of this is consent. And while all of the data is in the integrated data hub, we have attribute-based, where you can't see the data unless you're authorized to see it until consent. So as the behavioral health clinician, I can only see behavioral health data unless I have consent. I can't see anything with human services or housing or any of the other data, because the way that the system is designed, those controls are put in place. You also have, the different policies and procedures and documents that care coordination team members sign around the confidentiality of the information. The staff that are sitting on these teams are well aware that they sit on these teams for the purposes and the outcomes associated with well-being, self-sufficiency, and all the other key performance indicators relative to a cohort. So, this is not a gotcha model. This is around having information, and the teams are skilled, right? A lot of times, right, people in the beginning, depending on the cohort, they don't trust government, right? And so these teams are very skilled at soliciting information so that folks feel confident enough and they're able to sell them on, hey, you don't want to run around town trying to navigate all these different systems to get your needs met. This is a holistic approach where we bring it to you. We wrap around you and back away from you as you become more stable and self-sufficient. So I will say, the system has the ability to control who can access the data. But the foundation of this work is consent. So getting individuals to agree to share their, to have this team understand who they are in a holistic way is fundamental and foundation to the approach.
So I just wanted to build on that a little bit, Barbie. So you mentioned that the consent model involves folks not consenting to their data going into the data hub, but whether or not the team can access
see it. Yes.
Yeah. So how does that actually work in real life? Like, how is the consent obtained? Like, what does the consent model look like?
Yeah, so the consent form is very explicit. Our council was very clear about the need to list all of the entities that are on a care coordination team. And we went back and forth around, do I have to say Chris is on this team? Do I have to say Travis is on this team? Do you have to explicitly say for 42 CFR, these individuals are on the teams? And yes, right? So from that perspective, we put the burden back on us versus on the consumer of the service, right? And so I can share that information with you all. We've shared it widely across the country for folks who've heard me present on this and other forums. And this is just a portion. Usually it's more about the program and less about the legal and data sharing aspects of it. But the consent is, you're right. Someone presents to a system. It's a no wrong door approach. You present to any one door. And that, the individual that's doing the outreach is asking you questions, is trying to get more information. They're understanding, hey, if you're homeless, you likely have, clearly economic insecurity, food insecurity. And if you didn't have mental health challenges, you're likely to have mental health challenges as a result of being homeless. So then, they say, hey, I believe you qualify for this incredible program that brings all of these resources to bear and a stepwise approach to help you get on your feet. Now, there are people who are like, no, I'm not ready, right? There's individuals in the homeless population that are like, I'm still doing my thing out here. I'm not interested, right? But there are other folks who are like, hey, I'm ready, right? We have the violence prevention in Harris County. Yes, I want all these resources, education support, economic assistance, trade, et cetera, vocational trade support. And so they agree. And the training is robust in terms of being able to get informed consent from folks. And in Sonoma County, we brought in outside counsel, Foley and Lardner, who was very instrumental in supporting our effort in getting our consent forms compliant with federal and state law using Foley and Lardner, just because nationally they're known for doing this work. Brought them in to help support us there in Harris County with getting that consent. And that's fundamental. It's foundational. Those cohort managers are keyed into making sure that consent was informed. Questions at various periodicities in the process are, re-engaged to make sure that consent still exists. And that's how those teams move forward.
Got it. And I really like your emphasis there on informed, that that you're emphasizing that this is not just a consent, like it's not just a form, it is a process, and that folks are aware of what they're consenting to, and give it freely. Great. Well, do we have any other questions, Chris, from the group?
We do have a question for you, and I will take you up on the offer for sure to share the consent form with us, because people often ask us for examples, so that would be great. Okay, so Sue McGuire is asking the question about if you could expand a bit more on the governance committee, general population representation, objectives, et cetera. And Sue, feel free to come off mic after, Barbie's talked a bit if you have a follow-up question.
So there are two different governance bodies, right? There's the governance body for the entire initiative, which is made up of the executive leadership of the county safety net departments in both counties. And then you have the IT governance infrastructure. And so in local governments, they're typically IT folks. There's IT departments that does enterprise-wide support, right? But then there are IT representatives from the different safety net departments that sit on the IT governance body. It is that body that is defining the data elements, the terms and conditions under which, the configuration, the format for how that data, its current state, and how to get it over to be mastered and through the master client index process and into the integrated data hub. And then key pieces of information is pulled from that data hub into that virtual client record, based on what the teams say they need to know and understand about someone across multiple systems. It is stored in the cloud. I hope I answered your question in terms of governance.
You did. Thank you very much.
Okay, I have another question about, I don't see anybody else chiming in. What about, did you use a data map? I mean, I don't know if you got into that detail level of, if you personally got that, but if you used one and could talk about it, that would be helpful.
Yeah, so that would actually not be, at my executive level. I know that there was a ton of work done for the mapping process, but I can't speak to in detail. I just know that there was one that was used to make sure that, we're able to integrate the data and match it accordingly.
Okay. So another question that I had then was about, were there any when you were coming up with the functionality of all of this, were there any compromises that you had to make? Like your vision was going to be this, and you had to peel off a piece of it because you just couldn't get couldn't get buy-in, or the function couldn't work, or anything like that, that you had to?
No, I will say on the criminal justice side, there was a compromise because, like I said, going into it, I was unaware of the level of scrutiny and protections, right? I'm coming from the health side, and I'm like, it's all about us. We're Fort Knox. If I can overcome us, right, in terms of, getting to data sharing, then, the sky's the limit. But on the criminal justice side, right, the protections associated with that were challenging. Well, let me back up first and say, no, there was no compromise on the model, because as I said, this was sponsored strategically by elected leadership. Secondarily, they set very specific outcomes, because what we know is we spend a lot of money in our individual silos giving services, and then our outcomes aren't better because people aren't getting out of the safety net. And so this model allows people to get out of it. So that in and of itself, right? We'd have the sheriff saying, I'm running the largest mental health institution in the county, right? In both counties, right? I hear that. And we hear it a lot in a lot of other jurisdictions. And so the value proposition, right, in terms of data sharing across those systems was very high, and supported by those leaders, because they knew that they couldn't get the outcomes they wanted in their own systems without us working like this together. So I will say the one shift we made in terms of criminal justice data was that we only put criminal justice data in if a person was actually in, if they matched into the other data system. So they'd have to hit another system in order to be in there. So you wouldn't be in there, just a general member of the public from the criminal justice side. We didn't just integrate your data. You had to match. You had to be a match in the other systems, in one or more systems, the other safety net systems, in order for your data to be included. And so that gave a level of protection and security to our criminal justice folks that we just didn't have, you know, individuals' criminal data, background data, just in some system, even with the protections from an ethical perspective. We believe that we struck the right balance there.
But so then, just in terms of that data matching, I wonder if I can ask, I guess I'm trying to understand how the different sources would be matched, or let me ask it a different way. So does the individual get to choose which data sources are matched? And by that, I'll just kind of play on Chris's example. Like if someone's in public housing, but they have a criminal record and they are seeing a physician for substance use or something else, can they decide what data sources are matched up?
No, that's what I was saying at the beginning. It's an all or nothing proposition. And that is the key. Right? It doesn't work if you can pick, the systems wouldn't work, right? We don't have the actual roles and rule-based security to say, you're going to push this lever, turn this one on and turn this one off. So it's really, it's not that you don't get services, you don't get it through this model, right? And that is what the team is marketing and selling folks on, that this is the model. You tell your story once, right? And we bring the resources to you and wrap those resources around you in a stepwise approach. And then you get the services that you need. And so that is the selling point and the value proposition that folks are needing. Sorry, excuse me.
Got it.
Yes,
okay.
Working from home.
Apologies for that.
No problem at all. I think everybody on this call understands the joys of working remotely.
Can I ask one, if I didn't just lose it, because Maggie has a question teed up. Oh, let me ask you this. So I absolutely hear what you're saying. You know, it's kind of like all or nothing, like you get the whole wraparound experience or you don't get to pick and choose. But let me push on that and ask a little bit, like if the technology existed to make a more granular consent available, would your model have allowed for that so that somebody could choose, all right, everybody's in the pool with me, but I do not want my mental health records or them coming into this?
No, so that's the value proposition, right? The whole point is individuals run, this is why our systems don't work, because people have to run around town to each individual system. And sometimes, right, if you come in, you know, I in my presentation, I usually go walk through a case, what it looks like when they're not, the care isn't coordinated versus what happens when it's coordinated. Using a real, example of a grandmother who wanted, I think I might need to put my kids in foster care. He's involved in a gang, whatever those activities were, whatever his trauma is. So sometimes, right, people will present thinking, I need A, B, and C. And what they really need to stabilize them is G, to enable them to take advantage of A, B, and C, right? And so that is what this model is doing. It makes no sense to institutionalize and create technology that keeps perpetuating silos. So I talk a lot about like how, over time we've gone from competing against each other, safety net departments, to now we're handing off to each other, we're collaborating. What we have to get to is synchronized swimming, where everybody's in the pool together, everybody's working together to deliver, this beautiful outcome, right? And I have to talk about, like, I want to be the swan on the top, but I know I probably got to lose my COVID weight before that happens. But, the point being that the whole hallmark of this, the technology didn't drive, that would be making, is it the tail wag the dog, right? The whole point was we came up with this model, and then the enabling technology was created to fit the model that we believe would allow us to achieve the outcome. So we don't want to institutionalize through technology a fragmented system.
Okay, Maggie has been patiently waiting. Let me go on with her question then. She was asking about, have there been discussions about connecting with local health information exchanges, HIEs, and electronic health record systems? And then she said, to add to that question, as the data infomediary. Oh, who is the data infomediary? Is the Harris model mostly an aggregator of various data sources or one platform? Barbie, you can actually read this. I don't know about you, but
Okay.
I'm
I'm a processor, so I will go to that. But I believe the first question, so it was on HIE. So
Yeah.
In Harris County, we will be connecting and integrating with the HIE. The thing that is really was important to get even our county council to understand, the lawyers to understand, is this is not about HIEs. This is about public safety net data. It's not about just health information, because what kept happening is people kept coloring this whole effort with an HIE and the legal parameters around HIE. And so that was a barrier in terms of limitations on the vision and perspective about the work. And so in terms of the aggregator of various data sources or one platform, it is one platform. Now, I want to be clear, right? What also allowed us to do this work, because what most government entities will say, which is not the same in the private sector, maybe for those entities that are subcontracting with government, it's the same, right? I have to use this system. The state requires this system because the feds require these data across all jurisdictions within a state and across all states. So therefore, we're using this system. You are not giving up your source system. You're pulling data from these source systems into an integrated data hub that is bi-directional, that allows you to feed the information back and forth. And so that is, the key to this, that no one gives their source system up, because you can't, by law, you have to have it. And so while that used to be a barrier, no one's giving it up, right? Is there a parallel process? Yes, there is. But the outcomes and the cost associated with that outweigh, or the benefits outweigh the cost associated with those two parallel systems. I would encourage you all to look at the UC Berkeley Policy Lab study that was done on Sonoma that focused on the integration of these data. And then looking at high utilizers, right? They helped us come up with a methodology to identify the most vulnerable based on the number of systems and agencies they touched, the types of services and programs they utilized, the cost of those services, the duration of those services, et cetera. And they came up with, and I can send that over and you guys can share it. But that, that's de-identified data, but it was the precursor to creating the integrated data hub that we use for day-to-day transactional work in terms of care coordination.
So,
Go ahead,
Stephen. One question, Chris. I'm just wondering, this now has been implemented in Sonoma County, and you mentioned, Barbie, that it's being implemented in Harris County. So how have those two implementations compared? And have you learned things from Sonoma County that made it easier in Harris County? Have there been unexpected things second time round that you didn't experience first time round?
So I will say that Sonoma County, right? It's a mid-sized county in California. Harris County is the third largest county. The value proposition in terms of in Sonoma, able to get it differently. Of course, there's a different cultural landscape, political landscape, et cetera, in Texas overall, right? California is very blue. Sonoma County is very blue. Harris County is very blue, but in a red state, right? And so in terms of, getting attorneys to understand, I had to do a greater level of education. I'm still doing that, to understand the value proposition and to then say, okay, how do I get to a place where, I came from a program integrity background in the Fed, so I'm not a rule breaker, right? How do I get you to a place of understanding that there has to be a balance, right? And there has to be a different lens in terms of how you look at solutions versus what you've always done. So I say all that way in a diplomatic way to say a lot more work and education of county attorneys, IT department, in understanding the value proposition, and that value proposition driving the work versus, maybe some of the limitations and guardrails that folks want to put up about how they've always done their work, whether that's creating systems or legal parameters.
Fascinating, fascinating. I hadn't realized the extent of the differences based on just the different characteristics of the two locations. That sounds like quite the challenge.
You know, and I have to say, as someone who's not from California, but lived there way, way back in my life, you know, Texas presents certain challenges, you know, because of the political environment, but California's got a lot of regulation. So I would, you know, you know what I mean? Like just in terms of thinking about threading the needle, it's still a needle. You have to, you know, in each environment, right? So I have a question about from when you got the executive, you know, like decision, like, yes, this is a go, until it was actually implemented past the testing stage and up and running. How long a period of time was that?
In Sonoma, it went really quickly. This was actually implemented as part of the 2017 fires. So it was established in June as a priority for the board as part of their budget process. And then if you recall, the fall of 2017, at the time, Sonoma County's fires were the worst fires in California's history. We've since had worse fires than that. And we stood it up immediately. We actually, it was the beauty of it was the pre and the post test. We were able to see what it was like for individuals to get consent. We had about 300 individuals left in our disaster shelters 2 weeks following the fires. And we're like, well, they have to be the most vulnerable. They have no money, they have no housing, and the myriad of other things that go with that. And so we began with getting consent from them to participate, and then people manually checking their systems to see if these folks existed in their systems, to then creating a system and having their data in that system and enabling the team to be able to access that information. So it was really quite spectacular. So that I would say in terms of integration of data, that went, I believe in a 5-month period, we had 4 systems integrated already. Yes, yeah, it went quickly.
Were the lawyers all on vacation?
No, they were involved. They were involved. We were bringing them along, you know, through the process. And it's so important, to your point, that they're involved at the very beginning. And it's so important that they lean in and understand programmatically from the lens of what are we trying to accomplish? What are the key outcomes that our elected leadership want us to achieve by this model? And then think about how do we get to yes, even if they're not comfortable saying yes. And then allowing us, the other thing that I would say that is so important is differentiating between a policy call and a legal call, right? Sometimes you can get a legal opinion, but the policy is so compelling that you make a decision contrary to that legal opinion because the policy in a government setting is so compelling and so overwhelmingly important to the mission and vision of, you know, the elected leaders. So, you know, sometimes you're willing to run the risk. I'm not saying for me, that's not what we did in Sonoma. I'm just saying that those are the balancing acts, and lawyers have to be comfortable with the idea that sometimes a policy call is made contrary to a legal opinion.
Yeah, and I think other than Steve and you and I, if I remember right, there's only one other lawyer on the call. So everybody else is probably on the side of, yeah. Maggie has another question, and like me, it sounds like you'd prefer to read it if you want to look in the chat.
Yeah, so Find Help is not, Unite Us is not. I want to be clear that this is not a referral model. This is not a warm handoff model. This is a care coordination model. This is around, if I say to Chris, hey, Chris, I'm connected to these other entities and I'm going to give you a warm referral. That's not what people need, right? When we're talking about the most vulnerable people, you need to wrap around them, bring the resource to them. Folks drive people to their appointments. I've been blown away at the idea of like someone getting their birth certificate being such a critical and pivotal moment in like their care coordination and what their needs are. And so, Unite Us is a platform that is about connecting from a referral perspective. And so, yes, it could be a component of it, but it's not. The model is really around integrating data, having a client coordinate a universal view of a client that is in multiple systems and having access to that data.
And, you know, just for the benefit of folks watching the recording of the presentation, I just want to point out that the question was how you relate to other information and referral platforms, Find Help, Unite Us, etc. And it sounds like, Barbie, that one of the points you're making is that this is not a referral model, that it has to be a wraparound model where the services are brought to the individual.
Yes, and so it's not the consumer, right? It's the team saying, okay, I know that St. Joe's has this detox program, and while ABC down the street has a detox program, because we're intimately involved with this person and understanding them holistically, they're going to benefit from this program. So I'm going to coordinate that component of the service for them versus, hey, I'm going to now send you down the street to ABC, right? You know, that's the difference.
Thanks for a great question, Maggie.
And let me, I'm going to ask, there's certainly other folks have another question, throw it in the chat, and we probably have time for another couple. I want to ask you about, because the state, you know, so often the state is, you know, yes, they want better health outcomes, they want better life outcomes, but they're also looking to save money, right? And sometimes that's the most compelling argument you can make to them, like, you know, we're touching this person from multiple systems. If we coordinate, we can save some money on this. The other money kind of related question I'm curious about is, and I know California law is probably more progressive than a lot of other states on Medicaid reimbursement, but how, is there any flow of revenue that comes into that has grown as a result of this model? It's kind of a complicated question with a complex answer.
No, yeah, no. So that's the thing. I do a lot of work at the national level, having come from that system and recognizing the, you know, the collective impact and critical mass that we can garner for this approach to healthcare or population care. You know, I hate to call it healthcare because people get a singular, you know, notion in their mind, but this kind of collaboration and care coordination, that this is the way that you get to better health outcomes. This is where you get to savings on housing. This is where you get to savings in the criminal justice system. So I've done a lot of work around, you know, explaining that value proposition, and, you know, have been in a number of conversations with the White House around an executive order that Biden's signed into law a couple of months ago around looking at, you know, how to streamline integration of services post-COVID. And so, you know, still in those conversations and working with them. Just, you know, got an email the other day about this particular model. And so trying to get a better understanding that, you know, we often lobby for, give me $5 million for this service. And we don't spend enough time on looking at what are the enablers of us to deliver service more effectively, right? You have to have this infrastructure in order to get the outcomes. Otherwise, we just continue in our silos and not connecting people, not connecting their whole body to a system that connects their whole body.
How do you beat that last line? How do you end on a better note than that? Oh, hold on, there's a question. Esperanza, you ended it on a different last question. All right, let's see if you could beat that, Barbie. So are you familiar with other communities that have tried to implement the model and failed? And her question is, what were they missing?
So I wouldn't say failed, right? There are a number of counties in California, Orange County, Riverside County, some places in New York, Clark County in Nevada, Reno, Washoe County for Reno, you know, that are implementing this. I think it's not so much failure, it's the process of getting the buy-in, right? And so what I've always said is, hey, if you get your powers to be to say, this is thou shalt do your work this way, that goes a long way. And you not looking like the heavy as the public health strategist, but the boss is looking like the heavy, you know, to get this work done. So I can't think of any community that has failed, but just trying to overcome the various barriers on the ground, whether it's, you know, I've talked to, you know, county attorneys about this model, right? And some of their hiccups, or some of the IT staff. So I don't know if any have failed at this juncture in trying to stand it up.
All right, well, the opposite of failure is success. So on that happy final note, We really thank you. This was as good a conversation as I hoped it was going to be. And I was taking notes, and this is really great. I mean, we at the Network for Public Health Law, we often have kind of a bird's eye view, where we hear about different things happening around the country. And this is really so hopeful. I'm really glad to hear about a system of wraparound that really works well. And that the strategy that you used, starting at the top, especially when public health has had so many attacks against it in the last few years for governance and authority and all of that. Yeah, thank you. And the comments are coming in the chat too, just saying thank you very much. And this is really fantastic.
Well, I would like to offer, if anyone, because I feel like it's shortchanged on more of the programmatic overview of the model. If anybody's interested in having a fuller, more robust, in-depth discussion about what this model looks like, I'm more than willing to share that information. And I would just like to end with my favorite African proverb that says, when spider webs unite, they can tie up a lion. And if you can visualize what a spider web looks like with its holes, its gaps, its fragmentation, that is what we're often left with in government systems when we're trying to knit together the resources for some of the most vulnerable people in our community. And so, I end with that saying, continue the good fight of uniting your spider webs and figuring out how to enable that to happen in your communities.
Thank you so much.
Yeah.
Really, really fantastic. Thank you.
Thank you, Barbie. Okay, Travis, do you want to go back to my slides? And I think Barbie was going to have to jump off at that point anyway.
Yeah. But thank you again. I think I'm covering this one, Chris. Just a few parting thoughts for folks. So just a few announcements. So you guys have been very gracious in completing an evaluation for each of the sessions. We have one more evaluation left, and that's actually going to be for all 4 sessions. So you won't get an individual evaluation for this particular session, but you will get an evaluation for all 4 sessions. And if I can find my notes, that evaluation will come from Cara, and it'll come via Qualtrics. So just look out for that in your email. You will get an evaluation relating to all 4 sessions. The other thing I wanted to highlight is that the All-In National Meeting is coming up. It's virtual this year again, and it's October 25th to 26th. And the theme is centering communities to transform shared data systems. And there will be a session on none other than the Pathways to Yes. So we encourage you to check out the details on the All-In National Meeting and to register if you have an opportunity. Yes.
Jump in one thought. And if any of your colleagues who couldn't, commit to the all-in process, but you think they might be interested in getting a shorter version of Pathways to Yes, that session might be exactly what, would hit it for them in a shorter time period.
Great, great point. The Network for Public Health Law also has its fall summit coming up in Baltimore on September 13th to 14th. And we highly encourage you to check out some more information about the summit on the network's website. The theme is health equity, and that'll be in 2 components around health equity and data, and also cannabis policy and laws. And there will be several sessions, I think, of particular interest to this group, including on collection and dissemination of data to reduce health inequities, health equity and the digital divide, tribal access to health data, and reproductive health care and health equity. So please go to the network's website, and you can link there to the website for the summit. And actually, I see a note on here that the hotel and registration discounts end on August 22nd, which is in 6 days' time. So there's never been a better time to check out the information on the summit so that you can reserve a hotel room and register for the program. And then lastly, I just wanted to mention that although this is the 4th session of the Pathways to Yes, and that's the last session, the network does remain a resource. You can reach out to myself and Chris at any time. We have office hours that have been scheduled every Friday morning, and we would certainly be very willing to meet with you one-on-one if you wanted to contact us to do that. The network also has great resources on its website around data, including one written by Chris, which is actually linked in this slide here. So if you access these slides later, you can access a great piece that Chris wrote on coordination of care and how HIPAA allows you to share data in ways that you may not know. But so check out the resources on the network. And next slide, please.
Wait, before you go to that one, before you go to that one, just as a heads up, because Travis always posts these slides, after the presentation, you'll get a note from him when they're ready. The all-in national meeting and all these things that are underlined on this slide are links. So you can get a link right to the all-in national meeting, and you can get the link right to the Network for Public Health Law's Fall Summit. If you have a hard time finding it elsewhere, that's how you can get to all the information you need about either of those through the slide.
Good point. Thank you for that, Chris. And I do encourage folks to please complete the evaluation. We will be looking at the evaluation to figure out what we can do better. And so the data is very, very important to us. Now, with that said, Chris, I'll hand it back to you.
So I would say, so this is just an opportunity first of all, we had a few minutes, so we'll wrap up, but then if anybody wants us to stay on, we can certainly stay on a bit and chat. Travis, I wanted you to have an opportunity to, all of us, Stephen, Travis and I also just kind of like to weigh in on, this was hopefully a good experience for folks. And it was the first time that we did this presentation, so your specific feedback would be really helpful about if you think it's a worthwhile thing to do again, if you think we should have focused other places. Yeah, so thank you. It was really good to meet and connect with a few of you for sure. Travis, any deep thoughts?
I don't know if they're deep, but I'll just say I want to thank everyone for taking the time through several months to stick with us and listen to the content and participate in breakouts when we have those, and then engage with our panel at the last session and then our speaker this time. Really can't thank you enough for just committing all this time to learning more about pathways to yes, and then kind of ancillary topics related to data sharing and legal aspects related to that. So I'm also here to help support in any way Stephen and Chris. So as they mentioned, you'll receive some more information from me, follow up to this session. Again, Kara from All In will be sending out the evaluation, but if for some reason you don't get it or there's any issues with your link, you can reach out to me and I can coordinate with All In to make sure you're all set there as well. But nothing else to add. I'll turn it over to Stephen if he has any closing thoughts.
I just want to say thank you very much to everybody for participating. I have been very, very impressed with the level and depth of knowledge of this group with data. Every individual that I've talked to as part of these sessions has communicated different projects that they're involved in around data. And so I knew that we were working with some really informed individuals, which kept Chris and I on top of our game. So I hope everybody found it helpful. I know Chris and I and Travis found it very fulfilling. And so thank you. Okay, thanks everybody.